This is Dr. Jane from this clinic. How can I call you?
You can call me Ryan, doctor.
Ryan, nice to see you. I understand you are having the stuffy nose and flu-like symptoms, so can you tell me more about it?
I am having those symptoms for 2 to 3 weeks, doctor.
Okay, all right. So can you tell me more about it in details about your last episode?
I have been suffering from the runny nose and blocked nose and then itchy and watery eyes.
Okay, so how many days did you have these symptoms?
For the last episode, it has been happening continuously for 1 week, doctor.
1 week, okay? And how many times or episodes in a year you have these symptoms?
I'm not sure about the exact timing, but it is more in the springtime, doctor.
Okay, I see. So what did you take during these symptoms during the episode?
I'm taking loratadine.
Okay, so how do you take this medication?
Yes, I have been taking 1 tablet once daily. I also take some cough syrup to relieve the symptom, but it didn't work.
All right, how many days you take, these medication for an episode?
More than 2 weeks, doctor.
More than 2 weeks. Did you use anything else apart from these medications?
No, doctor.
Like any nasal drops or spray?
Yes, sometimes I also use seawater nasal drop.
Oh, okay. How many times and how many days do you use?
Yes, I only use in the first episode. But right now, I'm not using it.
Did you check with any doctor whenever you have the symptoms?
No, doctor.
Okay, and do you say only in spring you have these symptoms? And is there anything else you notice that make your symptom worsen?
I have been teaching children outdoor for their physical activity since I'm a physical education teacher, doctor.
Do you think the symptoms are worsen, especially after vacuuming or any smoky environment?
I'm not too sure, doctor.
Okay, do you have any discharge? Any color change of the discharge?
No, doctor.
Do you have any fever during the episode?
No, doctor.
Okay, you have blockage of the nose. Does it affect your sleep as well?
I guess sometimes I cannot sleep as it severely disturbed my daily routine, so I cannot work. Well, then I took leave since 1 week ago.
Any tiredness or sleepy? In the daytime.
No tiredness, doctor, but I'm a little bit annoyed and irritated because of the symptoms.
Ah, I see. Okay, so do you have any allergy, with medication or any food allergy?
No, doctor.
How about in family members? Anything like asthma or a hay fever?
No, doctor.
And how about you, when you are young, do you have any eczema or asthma?
Yes, I had the history of the eczema in my childhood, doctor.
You don't have any symptoms anymore, right?
No, doctor.
All right. And do you have any other underlying medical problems, hypertension or diabetes or heart disease?
No, doctor.
Apart from this medication, any other medication you are taking regularly?
No, doctor.
Okay. Do you have any concern before I explain to you about management?
No, doctor.
Okay, so according to your symptoms, I think you're having, we call it seasonal rhinitis, which is hay fever. So it was in springtime, and also especially whenever you are outside around the park area where there might be pollen or grass, they might worsen your symptoms. And so at the moment, I would like you to stop using the loratadine because it's not supposed to take longer time. So I will give you some nasal drop and also the steroid spray before you have the symptoms, before the springtime's coming. And then I would like you to test for the allergy test to check for you whether you have any allergy, to pollen or dust or any grass or anything, that makes your symptoms worsen. And so I'll refer you to the allergic specialist to do these allergic tests. So are you with me so far, Ryan? Do you have any questions?
No, doctor. Just tell me what I should know.
Okay. So whenever you have these symptoms, I would like you to use it whenever it comes to the springtime, 1 month advance. You can use the steroid spray in advance. Then you have to continue using it until the springtime over, so that can prevent from having these symptoms. And whenever you have these symptoms, you can use the nasal saline drops to relieve your stuffy nose as well. But I don't want you to use this loratadine because it is only affecting allergic conditions. I mean, the itchy throat or eyes. Also, if you find out any specific allergy, I want you to avoid that For example, if it is pollen, I want you to stop going out when they're the high pollen outside. You can check with the weather app, and they are showing like pollen count, so you can check the app